You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says no more dentures. Nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic of dental implants, Dr. Carroll. Dr. Carroll, welcome to the program.
Well, thank you, Randy.
You know, I called you an expert. But you've been involved in dental implants for how many years?
30 years, Randy.
30. You are kind of, this is your thing.
Yes.
We've talked on the phone. You love it.
I love it. Yeah, it's so exciting.
Now, for people that don't know your practice, you've been there 30 years. Who's your typical patient, and what are the different services that you offer?
Randy, our patient is every patient that needs dental work. We have patients that come in for general checkups. We have patients that need simple fillings. We have patients that are missing one or more teeth. We have patients that need dentistry today. Their front tooth fell out.
You have this thing, a machine, I guess. You make crowns right there.
Exactly. We have an E4D technology. It's a digital crown making machine that will make the crown right there within an hour. The patient's got the crown. That's exciting. We have patients that are missing one or more teeth. We try to encourage them to get a dental implant to replace that missing tooth root. It's the anchor or the tooth root that's so important, Randy. We have patients that come in partials and they need to have anchorage to hold that partial down. That's an area where they will not lose any more teeth. And that's important, Randy. We also have those patients that are in full dentures and they don't have a solution for anchorage. So we'll use 2, 4, 6, or a full mouth of implants, and we will give them a beautiful smile. That's what our practice is all about.
You do a lot of IV sedation dentistry.
Absolutely. We do IV sedation, oral sedation, because that is, the patient demands it. In today's dentistry, it's not like dentistry 30 years ago where you just sit down and grip the chair and hang on. Today, we accommodate the patient's needs. Some of them come in so fearful, Randy, that they'll break out in a cold sweat right when they sit in the chair. No more. We want to give them comfort so that they don't avoid the dentist, so that they come in and they get the dentistry that they need to maintain and keep that intimate
so they
part
can go
of their
in
body.
And they wake up, it's all done.
It's all done. They don't remember the procedure. It's very relaxed. Yeah, it's wonderful, and it's a necessary tool. Patients will just not visit the dentist if they don't have that option. It is their security, their safety net. So we employ it every single day.
So we invited you on the show to come and talk about dental implants. I guess, in a way, it's unique how you do it. How it's normally done, you say, is you go to one doctor that does the surgery. Then you may go somewhere else and they put the tooth on top, and then maybe somewhere else for the imaging. You do it all right there.
That's correct,
is that right?
Randy.
Okay.
That's correct. Right out of dental school, I learned quickly that implants was not understood by our dental profession. The year was 1985. I went and attended my first implant conference in Birmingham, Alabama. I was told in dental school that implants didn't work, charlatanism, don't try it. Nothing was further from the truth, Randy. I went to Birmingham, Alabama, attended a weekend seminar, and I was floored at what I saw. I saw everything but the kitchen sink supporting and anchoring patients' teeth and jawbone and giving them their smile back. It was amazing. And from there forward, at that point in time, I vowed that I was going to utilize this technology in my practice.
Are there a lot of people, a lot of denture wearers? Because at the top of the show, we said no more dentures. Are there a lot of denture wearers where you are?
Randy, in our location, there's probably, in the greater Houston area, there's at least 400,000 denture wearers in full dentures. That doesn't even break the ice cap of what we have in terms of partial denture wearers, are patients that are missing one or more back teeth and they're moving in that direction to a full denture and they don't know it.
Now, if there's, let's say you say 400,000 people wearing an upper or lower denture or full denture, and if all of them, like you say, the problem with dentures, they're not attached to anything. But if it's so good to get dental implants, why aren't they all doing it? What's your take on it?
The reason they're not doing it is that they don't go to the dentist anymore. They have been there, done that. They feel as though that they don't have that option anymore. They really don't know their options. That's why patients don't come in and take advantages of this wonderful technology. It's a marvelous, amazing technology. Another reason is they're afraid of the dentist. They've had failed root canals. They've had crowns that broke. They've had expense here and there. They've been, another $10,000, another, nickel and dime all over the place, and they feel like they're still losing their teeth. The diet is extremely important, and they've messed that up. Their teeth are failing faster than we can put them back together because of dental decay. Another reason is they're through. They've been to the dentist, they're over with that. They've gotten their dentures and they're out there free of pain. They're excited about not having to go to the dentist anymore.
But it does seem painful to get an implant.
The typical implant patient, after they've had the surgery, I call them post-operative and they go, I didn't take any pain pills that evening, or I took Advil or Tylenol, and that was it. Some of them have pain medication, and we get them through a day or two of pain, but it's not anything that's extraordinary. It's not even as painful as the removal of 4 impacted wisdom teeth. And the way we do this surgery is, I call it my stitchless surgery. It's an amazing technique. Bone is very plastic, very moldable, so we just manipulate. We don't take the gums away. We just open the bone and mold it around the implant. It's an amazing technology.
So the bone doesn't really have feeling then?
It has no nerve innervation.
So pain should not keep these people from doing it?
Absolutely not.
So they're afraid of that. That's a big fear.
Sure.
Because nobody likes the dentist, right?
Exactly.
Do you hear that still?
Oh, still hear that.
What do they say?
They say, I'm afraid of the dentist. I have to be put to sleep.
Do they say, no offense, doctor?
Oh, no offense, doctor. I just can't stand to be here.
Do you turn that around?
Yes, absolutely. We say we're happy to meet your needs and accommodate you no matter what your concerns, your fears, your apprehensions. We'll take care of that. Another reason is they think they're too old. We have patients that come in all of the time and say, I'd do that, doctor, if I was 20 years younger. And it's...
Well, how old can you be to get a dental implant?
91 is our oldest patient. Interesting, I had work with a world-class oral surgeon, and he was describing a 90, I think she was in her early 90s, and she could no longer eat, no longer function. And he said, what do you want to accomplish? And she says, my life is over. She's a duchess. Actually, her husband had passed away, a baron or a duke, and all she wanted to do was to be able to drink tea, have tea with the queen, and go out in public. Just, it affects their quality of life. So when is it too old? 90 is, if they're healthy and they can walk into the office, then we can give them dental implants and change their life. For her, it was, much more than just being able to have tea or going out. It changed her ability.
What'd you do for her?
Full arch of fixed teeth, full arch that was anchored in, nothing was removable. At this 92, she could laugh out loud. She could go out without embarrassment. She could chew the foods that she wanted, eat steak, eat meats again. It changed everything about her lifestyle.
Is this the happiest group of patients? The people that have no teeth and then you give them teeth back?
This is absolutely the happiest. It's you walk on water, Randy.
They want to hug you, I think you told me.
Yeah, absolutely. They're a denture disabled individual. It's like an amputee, and you're giving them very, very close to what they had when they had their own natural teeth, gums, and bone. It's amazing what they can chew. These patients that have been in a set of dentures for 30 years, they cannot chew their food. They just basically rub their teeth together. They can't masticate. It's applesauce, it's cottage cheese, it's things that, you and I order off the
granted, I
menu.
guess,
Yes, absolutely.
Well, tell me, isn't it true though that if you've been in dentures like 30 years, not enough bone to do this?
Absolutely not, Randy. We have technologies that not only will give them teeth in a day, that the procedure will get them chewing a soft lunch that afternoon. It's amazing. What people think is that they're not a candidate for implants. Other dentists have told them that they don't have enough bone. That's not true. We can take a patient and give them their smile back, even if the jawbone is wasted away after 30 years. We can give them a simple solution.
But if you're 70 or 80, are the implants more likely to fall out?
No, absolutely not.
No. Okay.
No, as a matter of fact, if you have the ability to heal, Randy, your immune system is good, then implants work for you. You know, you cut your finger, you heal there, the bone will heal. These patients are candidates just like you and I.
So no more dentures.
No more dentures.
You said the people on the day of the procedure, they could walk in with no teeth, they walk out with teeth.
Exactly, right. That's what's beautiful about this technology of moving the profession forward. Our imaging, 3D imaging that we have, now we can see where the bone is. We can get those implants. We are making implants to treat the patient. We are giving them stability instantly. It's exciting.
So when it's all done and they're healed up, I mean, they could eat like an apple with their front teeth or a carrot?
Absolutely. When it's all done, they eat. I ask them over and over, and they tell me. They come in and they say, I can eat peanuts. I can eat, carrots. It's just...
Popcorn? Could they eat popcorn?
Popcorn, absolutely. I had one patient that actually told me, he said, now I can bite a tomato seed. And and he said, before I couldn't do that. And that, was his description of what he had fine-tuned chewing ability.
Good for you. Now you believe, you've said it many times on the phone, that we're transforming people's lives.
Every single day we are. I had this one woman, and she came to me, Randy. She was distraught. She was, she would actually make sure that we went behind closed doors. She wanted to have the same dental assistant working on her. Nobody could come in and out. She was so self-conscious, so embarrassed that I literally had to leave the room. This makes sense to me, but I had to leave the room while she took her upper denture out. Then I'd come back in. It was as if she was undressing. She was, just, do you think she would be able to do that with anyone else? She couldn't even do it with me, the dentist. So what we did for her, we took out the denture, put in full implants, gave her beautiful porcelain teeth. Now when she comes in, she's a delightful, she's just showing off. She shows everybody her smile, all of the staff. I get so excited when I'm there to see the transformation year after year. It's a miracle. It is a privilege to work on these patients.
Whenever you have dentures and your food doesn't taste the same because you have the plate in your mouth that goes over the top roof of your mouth, with this, with the implants, it's just like having your own teeth. You don't feel that. You taste your food differently, and your teeth aren't falling down, and you don't have to worry about losing your teeth in the middle of a conversation. I don't think people really knew without me telling them that I had gotten them, because they're very natural. They look like real teeth.
Hi, I'm Dr. J. Thomas Carroll, and welcome to Today's Dentistry. With offices in Galveston and League City, we can service any of your dental needs. Because we have the experience and the latest in dental technology, like paperless charts, digital x-rays, Zoom whitening, and so many other exciting products, you can receive top quality dentistry at affordable prices. Hi, Megan.
Hi, Dr. Carroll.
With modern sterilization techniques, you can be assured that your dental visit will be most secure and comfortable. And if you're nervous about getting your teeth fixed, we can help you with the latest in sedation dentistry. We can offer doing your dentistry with light medication, or we can put you to sleep completely as we are certified in IV sedation. If your dental needs are a simple cosmetic makeover, or if faced with limited abilities to properly chew your food due to missing teeth or jawbone deterioration, with our 25 years of advanced surgical experience in implant dentistry, we can meet all your dental needs.
I know you brought photos and we're short on time, but there's also a group of patients that come to you that are, their goal is to avoid false teeth.
Correct.
Right? And so let's take a look at the photos. I mean, some of these are graphic, by the way, we should mention. Wow, is that unusual to see?
No.
I mean, it looks unusual.
You don't see it because they don't smile. They cover their face. They're just not showing what they really feel. If I didn't meet this woman at the time, she would be headed and in a full denture by now. Instead, we supported the teeth with implants, surrounded them, gave her beautiful crowns over the top. She was transformed from caterpillar to butterfly. Beautiful. This is the end result.
Wow, very nice.
And just did so much. I mean, she came in with her hair done up. She was wearing makeup, a complete transformation, Randy. I want you to really look at her front teeth.
Okay.
They are natural. They are longer, and that gives her a youthful appearance.
Like those front two teeth, a little bit longer.
Yes. And that's what we get proud about. That's what we love to do, is to sculpt, to have that artistic creation and give these patients something that their family, their friends brag about. They brag about it. It's exciting. People like this, they just get compliments all the time. It's something that they often say, oh, if I would have known, I would have done this 10 years ago. If I would have only known that it was going to not be so painful, I would have done it, years ago. Let me show you another patient.
All right.
This woman is everybody's grandmother. She is a delightful patient. She came in full lower denture for probably 40 years. No bone at all whatsoever, just the bare pencil thin in the lower front jaw. And she had been to 3 other dentists. Nobody could help her. She was, Randy, she came in and said, what can you do for me? And I knew exactly what to do. For her, we did a Ramus frame, gave her a
These
full
are dental
jaw,
implants, right? Dental implants.
Correct. A unique implant for a patient without bone. Don't have to go through the bone grafting. You can sit the patient down and do it that same day. Gave her a full arch of teeth. She was out and able to function immediately with transformed her life. Randy, she had so much adhesive that it was ridiculous.
So 40 years in a denture.
40 years in a denture.
And one afternoon, she now has a fixed set of teeth.
Now has a fixed set of teeth.
Seems logically like everybody would want to do this.
Well, Randy, the life of a denture wearer is something that you and I can't fathom.
I know a couple of denture wearers. They never complain to me.
They won't complain to you.
Okay.
Sometimes they don't even complain to us. They come in and they feel like it's done. It's non-reversible. We can change their future with these dental implant procedures now with remarkable ease. Look at this after, Randy. I mean, she is a gorgeous woman. She is now able to eat anything. She describes that she can eat peanuts. She describes that she can eat, steak. I said, is there anything that you can't eat? Nothing, she said. She can eat it all. And her children were so protective. They were like, what are you going to do to our mother? And once I assured them, the rest was, why didn't I do this before? Amazing difference.
Before I forget to ask you this question, denture wearers, when they go in your office, what are their options in regard to dental implants?
Well, their options, Randy, start simple with 2 implants, a snap-in, snap-out denture. The benefits of that procedure is that it is an anchor. Before, this denture just floats around. Now it's stabilized. It doesn't move. It doesn't cause sore spots.
No adhesive?
No adhesive at all. It's wonderful. No adhesive, no odor. Okay, the next option is 4 implants. Snap in, snap out denture, now more stability, now more like a full jaw of teeth. When they bite—
You do a lot of those?
Yes, we do a lot of those. When they bite, they can now transmit force back through the jawbone everywhere. The denture doesn't really put pressure on the jawbone and the gum tissue any longer. Amazing difference for the denture wearer before and after. Incredible. The next level up is 4 to 6 implants. Fixed, doesn't come out. The patient has the, naturalness and no insecurities of a bridge that's removable.
Okay.
That's great for their psyche, their spouse,
Well, that's what they want,
Yeah.
obviously. Teeth that don't come in and out.
Right. Then the next level is 8 implants or more and porcelain bridge work. And this is the closest that we have to our own natural teeth. Patients cannot tell the difference whatsoever. And that's their 3rd set of teeth, Randy. The next level is patients with very little bone, is the Ramus frame, a beautiful, economical service that we give them teeth in a day. The teeth are—
Full arch of teeth.
Full arch of teeth. Correct.
And they can really chew.
They can chew anything. The back of the jawbone, the front is so stable, Randy. This is where we take advantage. This is a mechanical advantage that gives patients the power with which they had with their natural teeth.
You're one of the few guys, you said, or maybe even the only guy out there doing this special implant system for very little bone. Is that right?
That's correct. I am the only fellow that I'm aware of in Texas doing this procedure, and excited to share it with others. It's that important. It's been proven for 50 years. It's not new. An amazing appliance. The next procedure that we do is we give patients freedom from the full palate denture. We take that out.
So for the upper?
For the upper. Have 4 implants to 6 implants and a snap-in, snap-out bridge, or sometimes with 6, and we have the stability and strength. See, we place implants by a bone molding, bone expansion technique that is amazing. It is, again, stitchless. It allows us to take thin bone, because the patient hasn't had teeth in years, and that bone, when we see it on the CT scan, is so thin, and we manipulate that bone, slide that implant in, and they heal, and they can have strength and stability throughout the jaw, and
in the same day.
In the same day.
And we should mention, you also have an oral surgeon that works there. Do you ever team up? You guys talk together about these things?
Absolutely. He's an MD oral surgeon. Very, very excited. This is an incredible individual, amazingly compassionate, good bedside manner, and he is so interested in the technologies that I've seen work in my practice for 30 years. Do I have time for another photo?
Okay, one more.
Okay. This patient, this is an amazing story, Randy. Yeah, this patient, this photo, that's her smiling. She didn't smile, didn't eat, couldn't wear her lower denture, absolutely wasn't wearing it. We gave her a full set of teeth, all implant supported, transformed her life. Every time she came into practice, I was so excited to see her and see the miracle that this implant provided for her. Amazing technology. And there's her teeth, Randy. That's the after. Yeah, stability.
Very nice.
Yeah. I have to show you this lady, Randy.
Okay.
This lady looks like, with her smile, looks like she's in a full denture. She actually has her teeth. Her teeth are loose. She's been wearing an appliance with the lower teeth hitting them, and it's rocked these teeth loose. Wouldn't smile. That's her smiling. Wouldn't smile. Wanted beautiful white teeth. We did this manipulative bone molding. It was a miracle. No grafting, and we were able to give her a full set of functioning teeth for 25 years. 25 years.
That's a happy picture.
She's a happy lady. She can, now with her set of teeth, porcelain teeth, she can eat and chew anything, changed her life. She goes on, just like you and I, has no inhibitions, no worries, happy, definitely she made my week every time she came into the office. Nothing could go wrong.
So you didn't tell her to hold that carrot. She's doing the carrot
she did that on her own.
To brag that now she could eat carrots.
Right, yeah, absolutely.
Is this the happiest group of patients? The people that have no teeth and then you give them teeth back?
This is absolutely the happiest. It's you walk on water, Randy.
They want to hug you, I think you told me.
Yeah, absolutely. They're a denture disabled individual. It's like an amputee, and you're giving them very, very close to what they had when they had their own natural teeth, gums, and bone. It's amazing what they can chew. These patients that have been in a set of dentures for 30 years, they cannot chew their food. They just basically rub their teeth together. They can't masticate. It's applesauce, it's cottage cheese, it's things that, you and I order off the menu.
Guess,
yes, absolutely.
Well, tell me, isn't it true though, that if you've been in dentures like 30 years, not enough bone to do this?
Absolutely not, Randy. We have technologies that not only will give them teeth in a day, that the procedure will get them chewing a soft lunch that afternoon. It's amazing. What people think is that they're not a candidate for implants. Other dentists have told them that they don't have enough bone. That's not true. We can take a patient and give them their smile back. Even if the jawbone is wasted away after 30 years, we can give them a simple solution.
But if you're 70 or 80, are the implants more likely to fall out?
No, absolutely not.
No. Okay.
No, as a matter of fact, if you have the ability to heal, Randy, your immune system is good, then implants work for you. You cut your finger, you heal there, the bone will heal. These patients are candidates just like you and I.
Okay. We are out of time.
Okay.
Okay. So according to you, no more dentures, or if you're headed for dentures, go see you.
Yeah, absolutely.
If you've been told you don't have enough bone, go see you.
We've got solutions for you. Absolutely. Okay. We've got hope.
Okay, good. Thank you for coming on the show.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.